feedback for them to make changes in their life. And just to finish off, this is just some of the companies that are currently part of the AMP Plus Alliance. So you can see that there's a lot of pretty big names there, and we have quite a solid backing, and it's getting bigger every year. And I'll hand it over.
Thank you.
So now we're going to hear from Miguel from Humana.
Yeah, my name is Miguel Encarnação. I'm Director for Emerging Technology Innovation at Humana's Innovation Center, which is kind of a think tank that Humana established to think outside the box and to look into the consumer space. And I'm trying to contribute to this panel from a little bit different perspective, which is not so much does technology motivate people to engage with their health or change their behavior, but why should they, right? Why should they buy a technology that motivates them to do something that they didn't want to do in the first place? And then once you ask that question, why should they pay for something that motivates them to do something that they didn't want to do in the first place? Right? If we can solve that problem, then we have a lot of problems solved, because then we are at CES, we are in the consumer space where everybody buys things that they really don't need. And nobody asks a question to the payer why they don't pay for it, right? Because the consumer pays for it already. So based on a solid body of science, we're working a lot with universities and are looking at the research of persuasive technology and behavioral economics. We are looking into what really drives people to do certain things. And earlier on today, we heard in one of the sessions the definition of value, which is a great thing if you look at hard products. But if you think about humans, value is very relative, right? The value of doing something right now competes with so many other things that you have to share resources with, or time with, or cost with. And what we decided to do is look into what is really driving people and what determines their values, and that is really their passions. Whatever people are passionate about, they will be willing to do frequently, to do often, and ultimately to pay for. If we then can inject into those passions things that at the same time influence the behaviors that we want to influence, then it's a win-win, if not a win-win-win situation. And here just two examples along those lines. We created about 3 years ago a health entertainment initiatives where we looked at the various gaming technologies out there, differentiated between the different audiences there are for gaming, especially in the health environment, whether you look at seniors, or whether you look at adults, or whether you look at people that actually have a clinical need or not a clinical need, whether you're thinking about more cognitive needs or physical needs, all those various things. And we came up with a variety of different applications, not so much really to now ultimately make a business out of it, but to evaluate how we can inject health into entertainment. And the hope is that by showing this proof of concept, and we have many collaborators that think alike, we'll create an industry that realizes that there's more in entertainment than the simple enjoyment, if you want. And the early birds at least got all a card in their package from our newest game, which is Femscape. For the people that came late or didn't get a bag, it's just myfemscape.com, and you get a free subscription there. I believe it's CSDH is the code if you go there, and you can try it out. There are no strings attached to it, nothing you have to subscribe to or so. It's just for families that want to live healthy and encourage each other to live healthy in an online environment. And there are a variety of other games that we've developed for various platforms, mobile platforms, for children with pedometers, all the various things and cool things we have heard about. You also see their buyer's digit system. There's also something we're looking into, so more for the clinical purposes. So that's one area. The other newer area that we are looking at is mediated intimacy. And yes, you're not in the wrong Las Vegas conference here. This is really addressing more the emotional needs that a lot of people nowadays have because of physical separation. Whether it is, parents frequently traveling, whether it is grandparents being separated from their grandchildren, servicemen and servicewomen being separated from their families. There is distance in a lot of the things we are doing, and obviously emotional health has an impact on all the other aspects of health. We all know that. And so we're looking into what can we do in this space. Again, something that the consumers would want to do because they want to do it and not because we tell them that it's good for them. And it might work that I show a little video clip of one of the early prototypes here. Yeah, if you can. Just press. So you have wireless teddy bears that are communicating sounds and other things over distance. And it's just to say, I'm thinking of you. It's lighting up. It can be a one-to-one or one-to-many relationship. Thank you.
Excellent. And now a last introduction from Ellen from Hope Lab.
Great. Hi, everybody. My name is Ellen Lapointe. I'm Vice President of Strategic Partnerships at Hope Lab. Sorry for the voice. I feel like I sound like Sylvia Poggioli today. I have a cold. Sorry, Sylvia. Anyway, I'm here to talk to you about work we've been doing. Hope Lab is in the business of harnessing the power and the appeal of technology to improve kids' health. We're a nonprofit organization based in California. And basically, our philosophy is this. We believe that if you lead with fun, health is going to follow. So I'm here to talk to you today. What do I hit here? Let's try it this way. Okay. We're very interested in the problem of childhood obesity at Hope Lab. And in particular in 11 to 14-year-olds, where you see significant increases in sedentary behavior in that age group. And to try to get at that, we have developed a product we're calling Zamzee, which is an online rewards platform that's powered by real-world physical activity. And it's designed really to meet kids where they are in many respects. First and foremost, it is a digital product. And as you all know, any of you who have kids or don't or work in the market, this is where kids are. The digital environment is a real environment.